Hello everyone. Thank you for joining us for the webinar today. The webinar is being hosted by the Interdisciplinary Global Development Centre, also known as IGDC at the University of York. My name is Piran White and I'm one of the co-directors of the IGDC. IGDC is an interdisciplinary learning and research community for equitable global development. We undertake research with a particular focus on social justice, global health and sustainable environments, and we also offer undergraduate and postgraduate academic programs in global development. We bring together researchers from across the humanities and the social and natural sciences within the University of York and globally, and we encourage researchers to work with one another and with policymakers and practitioners to address global development challenges. Today's webinar is the second in our Covid-19 webinar series. In the series, we're exploring different facets of the Covid-19 pandemic and how these relate to policy and research needs in global development. The series features invited speakers presenting case studies from across the world, drawing on their experiences to reflect on the impact from and responses to the pandemic. We'll be asking how global development researchers can contribute to a better understanding of the impact of Covid-19 and, importantly, reducing the likelihood and impact of future pandemics. Before we start the webinar, I'd like to mention a few housekeeping points. So firstly, recording. So just to let you know, the session is being recorded, but only the video and audio of the panelists. So all the attendees' microphones are muted and your video is also off and you won't be recorded. The only information that may be recorded are any questions you type in that might include your name, which may be identifiable based on your Zoom name. Second point is about questions and answers. So if you have any questions you'd like the panelists to address, please click on the Q&A button in the bottom bar on your Zoom. We'll then select questions from those submitted and try and answer as many as we can. You can submit your questions at any time, but we'll only have questions and answers in one slot towards the end of the webinar. And if you notice questions in the Q&A that you particularly like the sound of or that you were just about to ask yourself, you can use the upvote function to indicate this, and this will indicate that these questions have higher priority. If you're a tweeter, you can find us on hashtag IGDDCwebinar. And finally, if you have technical issues, you can use the chat function to talk to the IGDC webinar host. So just to reiterate, if you have questions for the panelists, you use the Q&A section. And if you have technical issues, you put those into the chat. So now I'd like to introduce our chair for today's webinar. So it's a great pleasure to have Christine Wallace chairing our webinar today. Chris is a consultant in international development. She's got over 30 years of experience spanning working with non-governmental organisations on relief and rehabilitation, managing area-based development programmes with UN agencies, and developing and advising on policy with DFID and the European Union. And she's lived and worked in Africa, Southeast Asia and China. During the last 10 years, Chris has been based in Europe and worked mainly on international education policy, programme management and monitoring and evaluation. Chris was responsible for the EU education policy paper, More and Better Education, and she chaired the International Task Force for Teachers for Education for All, which brought together all UNESCO member states to address the shortage of quality teachers. She also led the £800 million DFID-funded Girls' Education Challenge, which aims to ensure millions of marginalised girls are able to attend school and learn and improve their life chances. Chris has been a designer and contributor to training events both for EU and DFID advisors, and she was a board member for VSO. So Chris, thank you very much for chairing our event today, and I'll hand over to you now to get things underway.
Great, thanks very much, Piran. Okay, this is the first time I've done one of these things on Zoom, and normally, of course, we'd have a panel where we'd all be sitting at the front and we'd see all of you sitting out there smiling back at us. So differently, we're actually sitting here looking at ourselves on the screen. So in order that we get some idea of who we're actually talking to, we're going to try something. We're going to try and have a little poll to see where you're based and what sort of institutions you actually come from first. So as long as the tech works, I'm going to put this up first. You should see in front of you a question which firstly says, where are you based? And then the second part, will come up at some point, and we'll be able to see what kind of institutions you come from. And once a few of you have responded, I'll let you know, so you know as well, where everyone is and who they are. So far, half of the viewers have voted, nearly. And we're getting a lot of Europe, some Middle East, some North America. I don't know where question 2 is. Okay. Okay. Tara, I'm gonna press end poll. Oh no. How do I get the second question? Scroll down. Oh yeah, there we go. Look. Okay. Lovely. Okay then. We've now got about 3/4 of everyone saying, so we shall share. Can everyone see that? Yeah. So it looks as if we've got most people from Europe, but we have got the odd person from the Middle East and North America, overwhelmingly from academic institutions, a couple of think tanks and an international NGO or two. And if you want someone who puts himself down as other. Well, that's nice. Okay, so we've got some idea of who we're talking to. Let me just move that so I can see everyone here. So, a question to start with. How many times in the last 6 months have you heard the word unprecedented? It's been everywhere, absolutely everywhere. WHO said, as the coronavirus COVID-19 pandemic sweeps across the world, this is indeed an unprecedented time for all of us. The World Bank told us the global economy is in an unprecedented downturn. DFID said we're living in unprecedented times. We had an innovation foundation called Nesta in the UK. COVID-19 pandemic has brought unprecedented challenges both to people and society. And the UN calls it an unprecedented wake-up call for all inhabitants of Mother Earth. So there's no doubt that the effect of the pandemic is huge, and the resulting both health, humanitarian and economic crises are affecting all sorts of people. And I think we're increasingly finding now that it's affecting those who are already facing many, many issues more than anyone else. Many commentators seem to agree that the pandemic could see a reversal in the whole human development for the first time in 30 years. In fact, the Centre for Global Development called this the biggest stress test in decades for international cooperation. All scary stuff, but I've also seen hints every now and then about opportunity. Talk of a COVID-19 presenting some kind of liminal space, a space between where we were pre-COVID and where we might be post-COVID, if we ever get to post-COVID. A time when we can reflect on why we do what we do and how we might do it in the future. So what we'd like to do today is think about, is the development industry, what we're calling the development industry, are we in a liminal space? Can we actually take the opportunities that are being offered by this terrible disaster across the world to actually rethink how we do and where we do and with what and with whom we do things? So in order to consider these questions, we've got together an amazing panel of 5 people who each lead in a different aspect of the development industry, if you like, across the world. And we're going to ask them to explore what they think these unprecedented times mean to the organization that they're working in, and how they think they might be changed by those times. And it'll be interesting to see if they feel positive about what might come out of this, or whether it's all very negative. So we have 5 people. I'll run through quickly. I'm sure you've got the bios in front of them, but we've got Dr. Rita Bissoonauth from the African Union. Rita is the voice of girls and women's education for the African Union, and she's based in Ouagadougou in Africa. Joanne Bosworth is UNICEF's Chief of Public Finance and Local Governance, and she leads their global programmatic work to support the development of equitable social policies to realise children's rights. Then we have Nick Burnett, Dr. Nicholas Burnett, who has had over 30 years of experience in development, working with the World Bank, UNESCO, and most recently, Results for Development. And at the moment, Nick works looking at things which he feels that the general education community is not paying enough attention to. Then we have Jonathan Glennie, who's based in Bogota in Colombia. Oh, sorry, Nick is in Washington, by the way, Washington, DC. Jonathan is in Bogota in Colombia, and Jonathan's a writer, researcher, consultant, and practitioner of international poverty and human rights. He previously directed the Ipsos Sustainable Development Research Center. He's been director of policy for Save the Children, country director of Christian Aid in Colombia, and he also worked between 2010 and 2014 in the ODI in England. Also, who used to work with the ODI in England is John Young, our last panel member. John's executive director of INASP, which aims to support Southern individuals and institutions to produce, share, and use research and knowledge which can transform lives. Okay, so an amazing panel there, and we're going to start with a question, with our first question, which is, what challenges has COVID-19 placed on the development industry from your point of view? And we're going to start big. We're going to start by asking Jonathan what he thinks. Jonathan, over to you.
Unmute. Hello, can you hear me okay?
Yeah.
Now, as I understand it, I've got 5 minutes.
Yeah.
Okay, that's going to be a challenge. So you just jump in whenever I get to, you know, over my time. Thank you very much for having me, and great to be on this panel. It's interesting that people are saying it's unprecedented. Of course, you know, it is in a way, but then in a sense, you know, every new year is unprecedented. I mean, that's history taking place. I think the interesting question is was it unpredictable? And funnily enough, you know, I think the Black Lives Matter movement and was kind of predictable. It is the outpouring of a generational shift that is in part, you know, the success of increased opportunity and equality. And actually, you know, when development gets going and works, there is an equalization across the world. And one of the things we're seeing globally is that poorer countries, traditionally poorer countries, are more powerful now. And some of them are really powerful. And this is this kind of striking new global context that's got all of the West and the North worried, but it's precisely what the development sector has been working towards for the last 60 years. So it's perfectly predictable. And COVID, of course, you can't predict when you're going to get an outbreak of this nature, but it's perfectly predictable that there was going to be one. So yes, in a sense, it's unprecedented, but it's all perfectly predictable. And I think the unprecedented thing, or the thing that's hard to predict, is the politics. So you know, of course, some people did predict Brexit and Trump and all of that stuff, but that was quite hard to predict 10 years ago. And I think that's the major contextual challenge that the development sector has. For me, the COVID moment and the Black Lives Matter moment, which I think are of equal importance this year, by the way, I don't think tell us anything particularly new about our sector, but they change the political context very fundamentally and enable a more ambitious approach to development. And in a sense, it's now or never. If we can't progress things in the development sector in this moment of upheaval, then it's hard to say we will ever be able to do so. So in answer to the question, what's the main challenge, or what are the challenges that COVID has placed in the development industry? There are so many, but let me focus on one. I think it's ambition. The question is, how ambitious is our sector and how ambitious is our world for global development? Because COVID has demonstrated a number of things. Firstly, the idea that we're just on this gradual kind of progress, a history of progress, is clearly far too simplistic. A lot of people have been predicting the end of poverty over the last few years. You can see all the graphs from the World Bank, and including the ODI and other parts of the development industry, saying, you know, in a few years' time there'll be a handful of poor countries, and really, you know, we're on our way. Well, that was always simplistic, and it's now been demonstrated to be even more so. I think the pulling out of the development sector from middle-income countries, there's a quote that I always use from Paul Collier, a very influential academic in the development world, who said there is basically no role for international development in middle-income countries. And that, I think, has been the traditional view of the development sector. When you graduate from low income to middle income, you begin to see your concessional financial resources decrease, and sometimes quite drastically. Well, that's incredibly short-sighted, and COVID has demonstrated that. You need, if you're going to respond to global health problems of this kind, to have strong global health systems in all countries. I live in Colombia. We're miles away here from a strong global health, from a strong national public health system that can contribute to one that works across the world. And then there's the economic support. You know, you've seen in the wealthy countries of the world, billions, sometimes trillions, being put into, you know, response to the lockdown and the economic troubles that is causing. Where is the package for the rest of the world? It's peanuts so far compared to what is required. How ambitious are we? And I feel that the ambition of the development sector is pretty limited, and we accept quite low levels of kind of crumbs from the table. And I haven't even mentioned all of the other challenges that the world faces, quite apart from global health, the most obvious one being climate change, but continued poverty, inequality, all those kind of things. So fundamentally, our aid paradigm is outdated. It reflects a very although it's been quite successful in some countries, it reflects quite a limited ambition for what the world ought to be doing in the 21st century. There is a huge role for international development finance in all countries, including middle-income countries. And the fundamental idea that over time the aid program will be wound down, which is at the heart of all of our thinking. I've been brought up, and I've been in this for a long time, to believe that our job is to do ourselves out of a job. And you still hear people saying that. It's not. Our job is evolving. And we need to be a strong development sector, a strong civil society sector, a strong international public finance sector for decades to come. We are at the beginning of the international public finance era, in the same way as about a century ago, we really got going on the national public finance era. Before the turn of the 19th century, before the turn of the 20th century, there was hardly any money in the national public money in national economies. It was almost entirely for defense. But after the Second World War, you saw about 40% of GDP in public money. And that's the kind of progress we need to see at the international level as well. We're at the beginning, not the end. And I would kind of throw in an analogy with the European Union. Clearly, it's odd as a Brit to be talking about the European Union at the moment. We've made a historical mistake by leaving, and what we ought to be doing is shoring up these regional groupings. In the European Union, all countries pay into a budget and all receive. And the focus of the money is not just eradicating poverty or eradicating extreme poverty, it is convergence. It's bringing all countries up to the kind of standard that the richer countries would expect. All countries sit around the table to discuss. There's no donor recipient. There's net contributor and net recipient, but that's a very different thing. And billions of dollars, of euros in grants are transferred every year from wealthy countries to poorer ones, but still relatively wealthy countries. So Poland, Romania, the East, including the South, Italy, Spain, Greece. These countries receive international money. And yet at the same time, the international development community is talking about pulling aid from South Africa, from Vietnam, from the whole of the continent I'm in, which is Latin America, from countries like Zambia and Ghana as they turn middle income. It is an incredibly low ambition. And we need to transform the way that we think about international public money, inspired by what we do at the national level, inspired by what the EU has done over the last 3 decades in terms of redistributing between rich and poor countries within their particular club. And just to come to an end, I've absolutely no idea how much time I've got left. I've just been rattling through some ideas. But you know, there are some times when you do get big moments. And like I say, I don't believe that COVID has transformed our understanding of what's required as development experts, but it might have transformed the understanding of politicians and the public. And, you know, after the Second World War, Keynes and all that gang came up with a big new approach to international cooperation, the Bretton Woods institutions and those kind of, and that large-scale international arrangement. And that was possible because of the havoc that had been wreaked by a Second World War. Another kind of opposite example is at the end of the 1970s, during the oil crash, the right-wing monetarists had a plan, which became known as neoliberalism. And it transformed the world for the next 3 to 4 decades in quite a negative way. But the point is, at a moment of crisis, a group of economists and politicians had a plan. My question is, what plan does the international development community have at the moment, in this moment of crisis, so that the right-wing populists don't take this, as they did about 10 years ago, and turn it into an opportunity for them? Where's our big blueprint for change that Keynes had in the 1940s, that Friedman and others had in the late 1970s? Where's our big blueprint for change that pitches a new and better world based around international public money and cooperation and not privatization? And the answer is, I have it. It's called Global Public Investment, and I'm happy to share the document with anyone who wants it after the meeting.
Okay, well, we can talk about that in more detail when we go on to opportunities. Okay, can I ask Nick now? We looked at sort of the big question there about the whole development agenda. Nick, you're more focused on the education sector, on one sector. So could you tell us what your thoughts are? Thanks.
Yes, thank you very much. And well, that's a hard act to follow, but I've got a couple of slides, and maybe you could put the first one up, please. I would like to just begin by saying that I'm going to talk mainly about education in the sense of school, not so much about tertiary education, though some of what I have to say will be relevant. The first major point I want to make is that before COVID, education was not doing very well, frankly. Yes, many countries were getting richer and so on. Yes, more and more children were in school, but a lot of problems were persisting, and within the context of the SDGs, for example, it was pretty clear that the SDG 4, the one about education, was basically not going to be met by 2030. And just to run through a few of these things, and on this slide, what I put on the left are basically things about the education sector globally. And what I put on the right are things about the education development industry, since that's the theme of this workshop. So about 17% of children were not in school. This was before COVID. And about 100 million of those are in Africa, and the number is rising, and about 100 million in South Asia, but the number is falling. And indeed, the situation in Africa very serious, because it was very clear that even primary education was not going to be achieved for everyone by 2030, actually not even probably by 2050 on previous trends. Equally, not only was there an issue of children being in school, there's also, in part as a result of that, but also in part because of poor quality of education, there's a big learning issue globally. 53%, half of all 10-year-olds in low and middle income countries can't read and understand a simple text in their own language, age-appropriate text. We've also seen growing inequity between richer and poorer students within countries. It's a different picture actually in terms of the differences between countries. But within countries, the gaps between richer and poorer students have been worsening. The gaps for other sources of disadvantage have also been worsening. One important exception to that, the gender situation had been improving. The situation of girls had been improving. Public spending on education basically stagnant. Around the global average is around 4% of GDP. But something like 50 countries are not spending that. And that's almost all of them low and middle income countries. And then something a bit more, which may seem a bit technical, but is actually, I think, very crucially important. Huge emphasis on education planning, but much less emphasis on actually getting things done and on managing. So those are some things to do with the state of education pre-COVID. And in terms of the development industry, I've argued in an article, I'll be happy to send anyone who wants, that the international architecture for education was broken. The various agencies involved in education have not been cooperating well, have not got a good method for collaborating. Aid for education has also been stagnant and declining. And the basic method of operating, of course with many exceptions, but still the basic method of operating of the development industry has been basically for experts to fly in and fly out. And it's been around the idea of technical support, technical knowledge, not around, interestingly, around the idea of political support or helping countries, you know, develop their own ways of doing things. So if we can now turn to the next slide, basically the situation that I had described pre-COVID has been vastly compounded by COVID. And COVID has been, again, this word unprecedented, it has not been unprecedented in terms of what's happened with other crises, like when we have natural disasters, when we have conflicts and so on. Education has very often been the first sector to be stopped. And that's been true pretty much with COVID, and also very much the last to be reopened. And that seems to be going to be the case with COVID also. To state the obvious, closing schools as it now happened basically interrupts and reduces learning. And only a quarter of low-income countries are providing any remote learning opportunities, much less opportunities to poorer children. And this is not just a matter of temporary loss of learning, but it's also a problem that children get out of the habit of learning. And there's also a further problem that schools are providing services which are not just educational, they're often providing food, and their nutrition is beginning to be affected seriously also by the closure of schools. The remote learning efforts that do exist are still to be effective. The COVID crisis has accentuated the importance of implementation and management in contrast to the previous emphasis on planning. The broader economic crisis produced by COVID reduces demand for education. Parents find it harder to pay for education because while education is nominally free, there are always costs associated with going to education. And of course, many children also now, increasing numbers, actually go to private schools, and definitely there where they have to pay. It also reduces tax revenue and so public spending on education. And if it continues, it seems likely, not just because of education, but particularly because of education, that we'll see a deterioration in human capital and there's more scope for more social unrest. Specifically in terms of development, the development industry, we see education being cut much more than other sectors, unfortunately, aid being switched over to health and broader economic support. Obviously, we see the end of the fly-in, fly-out type of development, expertise, and also declining opportunities for independent consultants especially. So let me stop there. Later on, I can perhaps be a bit more positive about how I think some of these apparently awful things can actually be turned around in a positive way. Thank you very much.
Thanks, Nick. Ooh. Right, let's move now to Rita. Rita, what do you think, as from your point of view, which is going to be slightly different to the huge organizations that we've looked at so far?
All right, good afternoon to all of you. And I will talk about what is happening in the African continent. As the African Union, we cover 55 countries of the African continent. Next slide, please. And of course, as we all know, by April 2020, most of our schools in our 55 countries were closed. Of course, they were closed for the reason that we had to suppress and control the spread of the COVID-19 in our continent. As Nick already pointed out, we already had 100 million children who were already out of school before the COVID. And with this COVID-19, we had over 20 million learners out of school at the pre-primary level, 160 million at the primary level, 56 million at secondary level, and 8 million at tertiary level, who have had no access to continued learning and teaching facilities across the continent, and especially our girls and women, which I will come to later on. Of course, a lot of efforts have been deployed by our governments, by our heads of states, to ensure that there is at least a minimum of learning which is happening. And we've had TV programs, we've had radio programs, we've had it on social media to address the issue of this lack of continued learning. Some learners without internet have received hard copies of teaching and learning resources. Radios have been distributed to parents in remote areas, and teachers have tried as much as possible to dispense radio learning programs and to facilitate distance learning. We have had some countries which have even set up online platforms. But the biggest issue that we have faced is electricity, especially in rural areas where we do not have electricity. Connectivity issues is also such a big issue. In many households, when we are dispensing TV programs, most households have one TV, if at all, one radio. How do you go about this? Or one laptop. I mean, most houses don't even have one laptop. Even if they do, you have 2 or 3 children. How do you go about this? I mean, these are some of the issues that we have faced. Next slide, please. And of course, COVID-19, this impact of COVID-19 has a gendered impact. Schools are generally a safety net for our girls. And with the closure of the schools, our schools are no longer there to protect our girls. This crisis has put our girls at higher risks of sexual violence and exploitation, trafficking, early child marriage, forced labor, and social exclusion. Also, what we have had is this discouragement among girls and young women, which have clouded their hopes of success with heightened pressure from their parents to drop out of school. And poor chances, of course. I mean, we have to think of what is going to happen in the next 5-10 years. How will they access this labor market? What we have also seen is a widening gender digital divide. 25% of young women do not know how to leverage ICT for basic purposes. I mean, using Zoom platforms, being able to send their work through the computer is not an easy task. And these are, of course, these are issues which matter. We know that girls find it a bit more difficult to use those ICT. So I think COVID-19 has had a very, as you say, an unprecedented challenge in our continent, as it has in so many other continents. It has not been easy, but I think what our ministers of education have been trying to do is to try to ensure that there is a minimum of continued learning. So we'll talk more about this as we go on further. Thank you, Christine.
Fantastic, thanks, Rita. Okay, let's move on to UNICEF. Jo, how do you think UNICEF has dealt with, or what are the challenges first that UNICEF has been presented with by COVID-19?
Thanks, Chris. Can you hear me? Yes, okay, great. Thanks, Chris, and thanks to the IGDC for inviting me. So just to explain a little bit, my role in UNICEF is to support our teams around the world who work on public finance for children. And this means we're not in the business necessarily, the team that I work with is not in the business of giving out a lot of money. It's about supporting governments to use the resources that they have better and to leverage resources from the international community to invest in children. And one of the challenges that has come out, of course, from this COVID-19 pandemic is that although for children we know the economic and financial consequences are more severe in a way than the disease, these economic consequences are really going to be a massive setback to development progress for children. Can we move to the next slide? Yeah, so it's just a massive setback to children's development progress. We predict that at least 100 million more children are likely to fall into poverty by the end of this year, which will take us back to around 500 million children in poverty. Children are going to stand to lose the equivalent of about $872 per year from their future earnings, and that's an average. From the closure of education institutions and the disruption of learning. Progress on infant mortality is going to be put back between 5 and 15 years. Deaths from malaria predicted to increase back to pre-2000 levels. And many, many more children are likely to experience nutritional consequences, which will have long-term consequences for their cognitive development. So all of these things we know, it's essentially it's a disaster for children, and this is the major challenge that we're facing. The second part of that challenge is that these effects do fall disproportionately on those who are least able to cope, children in poverty, children whose parents are working in the informal sector, minorities, migrants and refugees, and also in countries that have less capacity to mitigate these effects. So the next big challenge that we are seeing is that the resources that are needed to respond are not yet reaching where they are most needed. There are policies that could be used to mitigate these consequences. For example, expanding social protection with a focus on protecting children, ensuring that we continue routine health services like immunization and nutrition support, expanding remote learning opportunities, but all of these programs require finance. And unfortunately, what we see so far is not very positive. Although countries are expanding social protection as part of their COVID response, in many cases this is temporary and hardly any of it is specifically targeting children. Many countries are already reducing education spending rather than investing the resources that they are saving from the temporary closure of schools in supporting remote learning. They're just cutting the budget. Some countries are even cutting health spending or diverting spending from routine programs like immunization into the COVID response. And despite a number of initiatives, the global response to date hasn't mobilized adequate resources to support national governments or to direct additional resources to the countries that are most economically vulnerable. The IMF estimated that $2.5 trillion would be needed by developing economies to mitigate the economic losses. But much of the ODA that has been devoted to COVID response so far isn't new. It's been redirected from existing programs. The additional concessional lending capacity from the IMF, the World Bank and others, there has been quite an increase in that lending capacity, but so far it's only up to about a quarter of the requirement. And the debt relief that is being provided is not available for middle-income countries, and it only covers part of the country's debts. It doesn't cover the private sector debt, and it doesn't cover debts to multilateral institutions. So all of this has brought quite a number of challenges for the work that UNICEF does around public finance. One is the scale of the crisis and its global nature, the speed of the impacts on government budgets, and the uncertainty of the future economic conditions mean that our teams in the field have to make rapid recommendations to governments on the prioritization of expenditures, which expenditures should be protected, frankly, the tools that we have and the approaches that we use sometimes take quite a long time to deploy. So this has been quite a challenge for us. Secondly, to really make visible the consequences for children, we need access to data and information. And again, the speed of the crisis has made this quite difficult. Some of the factors, the rapidly changing context, the impossibility of using some of the methods that we normally would be able to use, for data collection, such as surveys, or even just the, having very regular contact with counterparts in government ministries have become much more difficult logistically. And then I think also we tend to focus on spending, as I said, but obviously in the context of COVID, there's really much more need to focus on different topics and be involved in discussion of topics where we don't necessarily get very involved in the normal state of affairs. So that means really being involved in discussions around debt relief, around taxation, and these kinds of questions. Working more with the IMF, with whom we actually have a much stronger partnership. But these are just some of the challenges that we have faced in terms of this whole COVID crisis. Thanks very much.
Thank you. It's getting depressing. Okay, last but not least, let's move to John. John, tell us a bit more about the research community and the challenges there.
Yes, I was starting to feel depressed. And the first thing I think to say is that research is only a tiny part of the development industry. In 2018, about 2 billion was spent on development research globally, in comparison with 130 billion on overseas development assistance. But actually, even that is dwarfed in terms of other investments in the development process in southern countries. 150 billion securities and export credits, 160 billion foreign direct investment, and 226 billion in remittances. So I think we really need to look elsewhere than development research if we really want to look at the big impacts of this crisis. And some of the other speakers have spoken about some of that. But there's no doubt that COVID-19 has had a big impact on research. Just doing the research at country level is very difficult. Lockdown, travel restrictions in many countries, researchers can't get out and meet people, talk to people. And a recent survey we did of early career researchers in our networks identified access to the field and access to libraries and access to good internet connections and access to labs are all major constraints for researchers in the south who are trying to carry on doing their jobs. And for researchers in the north, providing the planned northern inputs to that has also been very difficult. They can't travel to countries. Everybody's pivoting to online approaches, both to set things up and to train local research teams to do the co-analysis and co-production of results. All of that's much more difficult, takes much longer to do. We're working, for example, with some researchers, health staff, teachers, local authorities, and traditional leaders in northern Nigeria on a project to improve adolescent sexual health in Kano. And that's now been hugely delayed, and we've had to scale back the ambition to really just a kind of planning the second phase of the work rather than actually getting on and doing things. So these are some of the problems actually getting things done. And part of that project was actually going to be to start to do some policy engagement work on what needs to change in order to improve adolescent sexual health. And any kind of policy engagement on anything which is not directly linked to COVID-19 is almost impossible at the moment. On top of all of that, as we've heard from some of the other speakers about other development interventions, many research donors are switching their funding into short-term COVID issues. We're involved in a big DFID-funded project called Strengthening Research Demand Initiative, which was supposed to be working with governments in Ghana, Uganda, and Pakistan to help them to build systems so that they could systematically improve the way they use their evidence for a wide range of policy issues. All of that now is about supporting the immediate COVID-19 research demands. And research funding is shifting into COVID-19. So, for example, the entire MasterCard Foundation research program, designed to support its work on youth employability and employment in Africa, has been diverted into short-term COVID-19 issues. But Southern researchers and operational agencies are actually interested in the longer term issues. What is the impact of this going to be on sustainability in the long term, food security, poverty, the spread of other diseases? Measles, for example, is still one of the biggest killers in the DRC, and they want to be able to continue to work on these things. And these changes, as we've heard from other speakers, are exacerbating other inequities in the research system. particularly in developing countries. Access to the internet's very patchy. Many early career researchers rely on their university connections to get onto the internet, which they lose when they're working at home. There's no doubt that well-established research institutes are much better able to access this new and changed funding than others. Women researchers under lockdown nearly always end up with all the additional domestic responsibilities for childcare, cooking, while their husbands quietly get on and finishing their papers. And apparently there's been a huge increase in manuscript submissions to the publishing industry, but nearly all of them are from men. And there have been many surveys about the impact of COVID on research. The Africa Academy of Sciences, a CGD, and others have done surveys. So if you want to know numbers, you can look at those. But I'm actually more interested in what's happening on the ground. And we have had a lot of stories published on our global platform called AuthorAid, one by Ruvarash Chigia Mujeni, a social scientist struggling to finish her PhD in Zimbabwe. She's got young twins, and she said the COVID-19 pandemic heightens the gender role disparities in society, also raises a challenge for rethinking of the burden of caregiving for female graduate students. So as I think Joe was saying, this has repercussions well outside the sort of research dimension. Another colleague of hers talked about the assumption that everyone can just switch to online approaches, and as also other speakers have mentioned, not all areas have sufficient connectivity for this. Researchers in remote parts of the country are left out. And we had one story by Rita, who works on gender issues at the International Water Management Institute in Nepal, said most of her fieldwork time has been swallowed up by interminable Zoom meetings and webinars, and she had to take leave just to get the reading she needs to get done. But she says she's getting better at other ways of doing things, and we can talk more about that in the next session.
Thanks, John. Thanks very much. Let's hope this isn't one of those interminable Zoom webinars. Gosh, well, you said something there, John, which seemed to sum up also what everyone else had said, actually, that basically COVID-19 has exacerbated already existing inequities. I mean, whether we're talking about the way the aid is given out, where it's given, whether we're talking about which sectors are supported, how the architecture is sorted out within the sector, where we're talking about gender came out again as one of those issues which has been the gaps which has been widened by COVID, both in terms of, as Rita talked about, the learners in school, and also the children and then the researchers. So an awful lot there, if that is what's happened because of COVID-19, I've got fingers and all limbs crossed that the next question will bring us some interesting opportunities and some ideas. So our next question, can we get the next slider there, Tara, please? Thanks, great. So is about the opportunities. So what do you think? Do you think that there are opportunities in this space, and what kinds of changes would the realization of these opportunities require? And we're going to start this round. We're going to switch it round and start from John and go back the other way. So John, you've told us about the problems. Now let's tell us about ways that people have thought about overcoming these.
Brilliant, thank you very much. And it's great to be able to segue straight into the second part of mine, because the thing that Gita Shrestha then went on to say was actually, I'm getting much better at doing phone interviews, web-based interviews, conducting virtual dialogues and webinars. So the way in which research is happening is changing. But before I talk about that, the first thing to say, I think, is researchers in developing countries have made a fantastic contribution to COVID research. And one of the big lessons that's emerging from all of this is, therefore, it is vital to continue to support southern research capacities. The Africa Academy of Science has identified 169 studies on COVID-related issues across a very wide range of disciplines, wide range of topics, from vaccine trials to media reporting, economics, mostly on epidemiology. 60 registered clinical trials going on in Africa as we speak. And really interesting innovations are emerging. For example, rapid genome sequencing and very cheap tests came out of research in Egypt. In Kenya, they managed to set up a surgical mask production line in just 20 hours. So there's huge innovation going on, and researchers and others in the South are really demonstrating that there are new ways of doing things in the new context. I've talked a little bit about new research methods. We're working with partners in Uganda and Nigeria. They're getting, like the person I spoke about earlier, much better at doing telephone interviews, online webinars, lots of interesting mobile phone-based applications to approaches to data collection, and using different platforms. So while we in Sierra Leone have found that WhatsApp is a great mechanism to enable researchers to carry on doing their work, another group working in South Africa discovered, having tried WhatsApp, that didn't really work, but Facebook really worked. So the kinds of methods that can be used in this new context are highly dependent on the contexts you're working in. And actually the whole COVID-19 challenge, I think, could be, according to quite a good blog on the ODI website, the catalyst to decolonize development research. They talk about reflecting on our position in the process. I'll talk a bit more about that in a minute, and the privilege, responding to the agenda from the South, researchers learning from the South how to do things better, building more equitable partnerships, and new collaboration models using more accessible communication tools, and particularly about improving access to global data sets. And I think what the COVID crisis has really highlighted is the importance of building what we in INASP call strong, equitable Southern research systems, and the importance of using science for policy, not that there's very much evidence of that going on here in the UK. So the need is huge, and I think this could really provide a tipping point going forward. And what's interesting, I think, is that researchers in the UK have a huge amount to learn from researchers in the South. One of our partners in Nigeria was doing his PhD on access to health services amongst immigrant communities in the UK, and he rather annoyed his supervisor. He was actually able to establish a better relationship with Black Muslim communities, and he found out more about access to health services among those communities in the UK than did his supervisor. So I think there are ways of doing research which in the South, which I think we could learn from here. But for that to happen, we need a massive change of mindset amongst Northern researchers who are so used to being in the driving seat in terms of international development research and controlling access to most of the resources and actually getting most of the benefits in terms of peer-reviewed publications. That really needs to change. And Northern research donors who now have slipped away over about the last 5 years from a recognition of the importance to invest in sustainable research capacity in the South need to flip back the other way. They need to provide more long-term funding for capacity development and long-term support to knowledge ecosystems. And also Northern and Southern policymakers really need to recognize the value of local research and data dealing with this crisis. It's different in different contexts and with all future crises.
Wonderful. Thanks very much, John. Okay, Joe, can we bring you back? What are your positive opportunities?
Yes, I'm sorry. Okay, so let me talk about some of the opportunities that we see. So the first thing I think is that we have a greater opportunity, hopefully, than we have to date, really, to bring the human rights dimension to economic policy and decision making, and to make clear connections between issues like inequality, exclusion and discrimination, and economic policy, economic and fiscal policy. We've seen the pandemic has brought out some of the costs and the challenges when countries do not invest and support social services and systems. So, for example, having health systems that leave out the poor, that leave out migrants, or where access is contingent on employment or parental employment in the case of children, the consequences of that. We've also seen the costs of having so many people excluded from social protection. And we know, for example, globally, less than a third of children, for example, have access to social protection systems. What do we expect families to do when they face a situation that, such as we have faced over the past few months? People are left with the impossible choice of observing public health containment measures or going hungry. So some of these things are really bringing out these questions around the importance of investing in social services and social systems and taking a human rights based approach. We have multiple human rights instruments that make very clear the obligation of governments and also in the framework of international cooperation to use resources towards human rights. For example, the Convention on the Rights of the Child, which is our guiding instrument, states that obliges states to take measures to implement policies for children to the maximum of available resources. So all of this, I think, is really bringing home to people the importance of government's role in policies of inclusion and delivering equitable and accessible services, which have been underfunded for a long time. So we can hope that this maybe gives us an opportunity for greater support for the role of government and the need for progressive taxes to finance these kinds of activities. The second opportunity that I see, which is builds on the first, but really goes to the heart of the role of our mandate, is that within that overall framing of human rights, we have the opportunity to put children's rights at the center of global and national stimulus packages. All the major global actors are in agreement as we move past this response phase and into the longer period of uncertainty and reduced economic activity that we're going to need fiscal stimulus. But history shows us that in the past, what tends to happen is you have a period of fiscal expansion, and then that tends to be followed swiftly by the imposition of austerity measures. And those measures harm and even kill children. This time we have the opportunity. There are low interest rates. We have a lot more knowledge. We have the potential to take a different path this time round. And instead of merely protecting spending on children's services for children, to increase spending in areas that will make a positive impact on children's development, but also on the future of economies and societies. There are two things that I would like to flag in particular. That programs for children are an investment, that they often have wider economic and social benefits. So social protection programs not only protect children from poverty, but they also put money into the hands of parents, and they have multiplier effects throughout the economy. Expanding affordable quality childcare also not only allows parents the time to work, it develops children's skills and it generates employment. So these are good investments to be seen as part of an overall fiscal stimulus. And we also see that there's a lot of call for linking fiscal stimulus with green growth and green jobs, given the disproportionate impact of climate change on the poor and the longer term impact of climate change on today's children. Investing in a green stimulus would also be great for children. Finally, another opportunity is to really redefine our understanding of humanitarian emergencies and give greater emphasis to the human and social costs of economic crisis, and the opportunity therefore to build this into our models and approaches for resilience and preparedness for the future. A few examples of what this might involve. We need to develop an inventory of services and expenditures that are essential and should be preserved in advance of a crisis to avoid hasty and often harmful decisions over prioritization, as seems to have occurred in this case. We need to expand work to develop financing mechanisms to increase the coverage and sustainability of social protection systems, to make social protection systems more capable of responding to generalized shocks, and to mobilize national and global resources to support this. We need to make more progress on aspects of aid financing that we've been talking about for a long time, such as bridging the humanitarian and development divide, working more on the localization agenda. And we also maybe could take the opportunity of reforming elements of the international system to make it fairer, such as agreeing in advance more mechanisms for concessional finance for low-income countries, debt workout mechanisms, etc. So lots of opportunities. I hope that's a bit more positive.
That's great. Thanks very much, Jo. Okay, let's move on to Rita. Rita, what sort of positive opportunities can you see?
I think what has resonated across all the discussions that we have had here at the African Union is that this pandemic has widened social inequalities, especially in the area of education. However, there are opportunities in this liminal space. And I think the first one is, of course, the resilience. That is the capacity of being able to adapt, being able to do something very quickly. And this is what all our member states have done. I mean, there have been efforts from all our countries to deploy learning programs, as I said, TV, radio, and social media, to ensure that learners have at least a minimum of education or some learning hours. There has also been some information on the radio, on the TV about the issues of health. And some learners without internet or radio have also received some hard copies of teaching resources. Caregivers in remote areas have been able to dispense radio learning programs. So I think this is the first part. And I think that our ministers of education and other ministers from different ministries are aware that we need to be better prepared if there is another pandemic next time. And this is why I think they are now planning about ensuring to have enough infrastructure and resources, especially for educational purposes and for being able to learn online. Ensure that we have enough TV and radio programs well ahead, and not TV and radio programs or online courses which are just made along as time goes by. I think there is also a need different at the highest level, at the ministerial level. The teaching and learning process has to be rethought of. What type of policies do we need at the teaching and learning process? I think the policies will now be more focused on the learner, on the needs of the learner, and less on being teacher-centered. I think what is very important is that this pandemic has shown us that the teacher is not at the center of learning, but that the teacher is more of a facilitator in the teaching and learning process. So this brings us now to the teacher training issue. That means if we have already agreed that the learner is at the center of learning, that means the teacher training then of course follows. That is, the teacher training has to be designed. We have to think of more modules with strategies where the learner is more at the center of the learning, and ensure that technology is used at the optimal use to ensure adequate and optimal learning. There also has to be, I think teachers now have to be taught how to design online classes. There are so many teachers who have no idea what is an online class. It is just not putting PowerPoints one after another, or just putting up your Word document. This is not what learning and teaching is all about. And this is what has happened very, very often, that we have seen this in many countries. And as we have seen, many of us have talked about the gendered impact of COVID-19, and of course it has had a big gendered impact. Many girls, unfortunately, have not been able to have any access. For example, in a house where, for example, you have a boy and a girl, and they have a class which is happening on the TV or on the radio or online, the boy, unfortunately, is given the priority. So the girl, very often it's at the same time. So the girl has to do her household chores, has to go in the fields, or has to look after her baby brothers or sisters, and has not been able to continue with this learning process. So then there is a fallback. So there are two things that is happening, is that ministries are thinking of having catch-up strategies when schools are going to reopen, and I think this is really, really important. And another thing which is very important is having a campaign for reintegration of girls after schools are going to open. Because we need our girls to go back to school, because we have seen that during the Ebola crisis, the rate of teenage pregnancies rose. And if our schools do not ensure, the school administrators do not ensure that that girls go back to school after this crisis, then the number of child marriage, of early pregnancies will rise. So I think this is very important, is that girls and women will be more at the fore after this pandemic. Thank you.
Thanks very much, Rita. Gosh, okay, so lots of opportunities there. Jonathan, one of the things that's come up again and again is that funding needs to be more and better. Have you got some ideas around that for us?
Well, I think there are huge opportunities here. I think it does go back to whether we take them or not. It's fascinating to hear that Rita talking about TV and kind of modern approaches to education. I'm sitting here with my kids, and all of a sudden they can access, I mean, they've always been able to in the last few years, but one hasn't realized it until COVID, they can access teaching from around the world. So there are online classes being given. We live in Colombia, my family is British, so we can access British schools, we can access US resources. We can also access African resources and classes being given and developed elsewhere in Latin America. This is amazing, both in terms economically, possibly for countries to start selling educational resources, but also in terms of opening up the minds of my kids to different perspectives from around the world. Not being capitalized on very much at the moment, but I think that's a great opportunity. But just one of a million opportunities. People talk about seeing, you know, fewer planes in the sky, the impact on the environment that we're seeing from COVID. I mean, there's 100 million opportunities. There's also great risks, particularly from the amazing economic impact that we expect. And Joanne gave us a rundown of what we expect in the global south. In the global north, it's also going to be really differently very negative in terms of jobs being lost. There isn't the same level of poverty, so you don't see the same level of terrible devastation, but the political impact of that could be very great. And you know, coming off the crisis, the financial crisis in 2008, a lot of us foolishly thought that finally everyone would see how you know, over-liberalization and had led to this crisis, and that we needed a kind of a better relationship with the banks and all that stuff. It didn't happen. What we got was a new era of right-wing populism in the north, and somewhat copied in the south, which has been really is the major threat to our world at the moment. So how will this play out? It's totally unclear. I do think we need to, you know, emphasize how COVID has demonstrated the interlinkedness of our world. The reality, the tragic reality is that the West is focusing on COVID. It's fairly obvious because it's impacted the West in the same way that AIDS did a few decades ago. It's hit rich countries. If it was only hitting the South, as so many devastating things do, then there would be far less interest in it. But we need to capitalize on that. Another thing that a lot of local organizations and national organizations are saying is that the reduction in travel does mean that local leadership and national leadership comes into the fore, whereas our industry, the development industry, has a terrible kind of knack of sending, quotes, technical experts around the world to kind of share their expertise, which may or may not be any good. So that has been significantly reduced in this period. And there may be learning from that as well, coupled with this incredible Black Lives Matter movement, which is focusing on, and John's mentioned it, the kind of, you know, the neo or the post-colonial, still colonial attitudes that pervade our industry, because that is where our industry came from. Yeah, there are huge opportunities. I don't feel that there is a clear proposal on the table from, I guess, our industry or from the progressives in international development about a new way of doing things. Certainly not in the North. There are much more ideas coming from the South, but they don't get heard very much. But in where the global industry, development industry sits, which is basically in Washington and London and those kind of mega power areas, it's all a defensive strategy. So it's how can we just about get a little bit of this to help? And of course, you know, we need to be realistic in our politics, but we also need to have a vision of the big picture. You know, what are we actually going for? And it's not just a few crumbs. I mean, Joanne even used, you know, you use the term poverty, and I understand why you do that. You know, there are 500 million children in poverty, more children in poverty. But even that use of the term poverty is an unhelpful one, because there's, apart from, because that, what you meant is extreme poverty, I believe. And just above extreme poverty, we've allowed ourselves in the development industry to use this term poverty and imply that people just above that random line of poverty that we're using, which is a totally random invention of the World Bank and used by all of us, we imply that they're not poor anymore. And we imply that middle income countries are no longer poor because of a language of middle income, also a totally random threshold that's been invented by economists. You know, in my region, Guatemala is the best example I have, and Joanne mentioned nutrition. You know, a third of Guatemalan children were malnourished, were short for their age or thin for their age, well before COVID. And Guatemala's been an upper middle income country for decades. So our ambition as an international development sector to basically, and I know that UNICEF and others will continue to focus on kids all over the world, but overall there is this move away from countries like Guatemala and just focusing on, you know, a handful of the very poorest countries. It's a total failure, in my view, to respond to the real needs of the globe. And I understand why. It feels incredibly difficult politically to get anywhere. But we need to have something. We need to have a manifesto. Otherwise we're kind of, you know, we're kind of accepting defeat before we've even tried.
Okay, great. Thanks very much, Jonathan. Nick,
Yes.
Well, you've got some slides. You've got some other ideas about opportunities, how the education sector can take.
Well, yes, I have some ideas, but they're actually somewhat linked, I think, to many of the ideas that the other speakers have mentioned. So I'm not going to spend a lot of time on all the points on this slide. Rather say that I think that there are three big opportunities, which would be the three middle points on the left-hand side of my slide there right now, but all of which we will have to wait and see whether or not they really can be realized. As Joanne has suggested, and as others have suggested, Rita also, you know, a renewed focus on equity and inclusion, including, of course, for girls, does seem to be one potential area in which education could come out of this stronger. Secondly, paying more attention to the public spending, and we've heard how the spending has been cut, spending on education has been cut, but it's no longer, I think, going to be possible just to talk about that spending. We're going to have to spend much more time, whatever sector we're in my case, education, on broader issues to do with tax and to do with revenue generation. I mean, every sector is going to have to pay attention to this. It can't be just now left, I think, to the macroeconomics. And then more specifically in the education sector, where I indicated earlier that I thought there was excessive attention to planning compared to actually getting things done and doing things. I think that this is the fact that countries have had to react quickly. It's fairly easy to close things down, of course, But as they start to open up schools again, we're going to have a lot of management, a lot of implementation, and a lot of lessons that we can learn from this. I also want to draw attention to two, I think, key changes that, or two key areas that could also benefit from this. I had referred in my remarks, and Jonathan just recently in his remarks mentioned the kind of what I call here, second from the bottom on the right, fly in, fly out type of development, or the development industry. And I think this really does, the fact that people can't do that now really reinforces what we already knew, which actually that type of technical fly in, fly out support hasn't been very effective. What has been effective has been coaching, long-term coaching, which is not necessarily north-south coaching. And indeed, the whole concept of north-south, it seems to me, doesn't make much sense when we're talking about education anymore, because these issues are very much global, and different countries can learn from each other at all different levels of GDP per capita, for example. But I do think that the idea of moving towards a much more of a sort of coaching approach, which requires developing the capacity to coach. I mean, you can be good at something yourself, but it doesn't necessarily mean you know how to get to help someone else become good at it. So this type of an approach, which I think could lead to much longer term effective capacity development. I do think that's one area particularly important for education, but I might argue also more broadly. And then the second thing I want to draw attention to, and link, it's a very sub area of research, but there are two areas, especially on education, I think that we really need very urgent research. And again, we knew this before, but COVID has really reinforced that. The first is about education technology. We basically don't know anything about what technology works and what doesn't. We basically only know that individualized learning works. But for that, of course, you have to have programs, you have to have sophisticated equipment, or not so much equipment, but sophisticated software and so on. You can't do that sort of individualized learning over radio, for instance, which is one of the main technologies currently being used in low resource settings. So I think a lot more research into technology, how to make it work for learning, but also into its costs. The costs of, we're always being told that oh, technology is getting cheaper and cheaper. Indeed, this is true. But it is not the case that the things that go with the technology to make for effective education, such as getting teachers and parents and others, you know, to be supportive, these sorts of things, training people in how to use the technology, these sorts of things are not usually typically costed. And they need to be looked at as well as just these kind of hardware and software costs. The other area of research, and again, this may be broader perhaps than education, I'm making a point from the point of view of education, is as the world learns from COVID, we're going to see which societies managed to maintain reasonably resilient education systems. And there are going to be important lessons from that, I think, for all societies. I don't at this point, I think we know enough about who has done a good job and who has not. We can see certain things, but we can't really tell in terms of the impact on learning yet. But I think that this will be a very, very important research area. So I think that these two quite specific and quite different research areas are among the very positive things that could come out of the COVID-19 crisis, and which will have much broader implications for education than just the COVID does. Thanks.
Thank you. Thanks all. So we've got some great opportunities. I mean, we want to redesign the international aid architecture to have a renewed and a stronger focus on equity and inclusion. We want to look, all sectors, to look more at the bigger picture. So we're not just looking at funding education as against funding health, for instance, but actually thinking about what the tax and resource generation issues are in order to be able to do that. And we're also talking about a lot of a lot of attitudes changing around post-colonial aid attitudes about this. Jonathan mentioned ridiculous learning, the North and South. Nick also the same. We need to learn from each other, not only in the sectoral specialisms, but also across the whole, identifying those countries, those sectors which have actually been resilient through COVID and being set up to continue, to allow continuation, and learning from them as to how we go forward in the future with that. Also, Rita mentioned education technology, as Nick did. This whole idea of technology, and John mentioned the fact that research is being done differently using different technologies. I wonder though, the reality of all of this, that you know, we need, for education technology, for instance, we need connectivity as well as content and capacity. Technology for researchers, as you said, is often difficult. So I think there are still a lot of barriers to actually realizing these opportunities. Well, we've got a lot of questions have come in. The one which has been voted most is asking about the merger of FCO and DFID. And if everyone doesn't mind, I think I shall leave that till a little later, because I think that could go on and on, especially when you've got two ex-DFID members on the panel. The next one that has had fairly few votes we've got is John. I think you might start with this one. Question for research-oriented panelists. And then others, of course, also have ideas on this. Given problems of online surveillance and insecurity of many online platforms, what kinds of communication tools do you think are the best to use for conducting research and sharing research, especially in contexts where state surveillance is a problem or research informants may be at risk?
Well, I think I'm going to pass straight to my colleagues on this. We don't really do research. We do research capacity building, and so we haven't really had much to do with this. So I can't really comment.
Okay, anyone like to take that one up? No? Okay, maybe we can think about that one and come back another time. Jonathan, you mentioned that there are examples of doing aid differently now emerging in the global south. Can you and the rest of the panel give some examples of how aid agencies located in the global north can learn from how COVID and its impact have been dealt with by those in the south?
So I don't know, COVID's still very new. I know it's transformed our lives, but it's only been really a few months. So I can't give an answer of how different countries are managing COVID. I haven't been studying that. But I can say how the dominant understanding of aid is challenged by the way that things are happening in the South. And one great example is the Global Fund. Now, the Global Fund is a huge and pretty successful fund to fight AIDS, tuberculosis, and malaria. What very few people know is that it's not just the major donors that put money into that. So some of the poorest countries in the world put money into the Global Fund. So it was just replenished last year in France. And you had countries like Burkina Faso, Zimbabwe, Zambia, I believe, putting money in. Now, why would they do that? How does that make sense? In the traditional aid understanding, you have rich countries and they send money to poor countries to fill a financing gap. But in the Global Fund understanding, all countries are invited to put money in, obviously, depending on their ability to do so. And a lot of countries are able to bring money out, to receive from that. And why do poor countries do it? Because they don't want to be considered recipients anymore. It's an old-fashioned 20th century concept to say, look, we in the North have and we will send to you. The idea behind global public investment is that all countries can contribute according to their need. And all countries, including some of the richest countries, may even be able to benefit according to their need. I think I said need before, I didn't mean to. So even parts of the US, given the terrible management of this disease, might benefit from an international fund to actually engage. You know, the idea that the West gets so fidgety when the UN turns up. You know, the UN, maybe it was UNICEF, did a report on Britain, on British poverty. a few, like maybe a year or two ago. And the response of the UK government is, what the hell is the UN doing in Britain? We're a developed country, look at us, you know? And but somehow everyone else in the world is meant to take UN reports and take them seriously. But in the West, we just kind of throw them in the bin. We need to transform this kind of idea that the West is sorted, quotes, developed, probably the most arrogant analysis of a country there's ever been, whereas the rest of the world is developing, still requiring help. And I think, you know, everyone in the South gets that. It's only in the North where we don't get that, where we still kind of cling on to this old-fashioned and frankly, self-serving analysis, because I used to work at Save the Children, Christian Aid, a number of other places, even UNICEF. I didn't work there, but it's true of UNICEF. It is useful to perpetuate the myth of charity because it brings in the money. And that is that's called poverty porn. And it's a really, really difficult thing because the marketers will say, well, do you want 2 million or do you want 500,000? You know, with the 2 million, you can help more kids. And you have to manage the kind of long-term change, which says, look, we might have to accept somewhat less money in the short term, but we've got to get dignity right. And we've got, and by the way, I've just seen a comment from, or a question from Indrajit Roy, who wrote one of the best papers I've read in the last few years on dignity. I've tried to get in touch with you, Indrajit, and I've failed to do so. So if you're able to get in touch with me after this, I would love to talk with you about that, because it's the whole point is to shift that. And the example he uses, I just have to use it because it's a brilliant example. And I don't know if it's really responding to any question, but he did an analysis of some landless workers in Bihar. And the mayoralty and the local government offered them better housing. And the landless worker says, we know development for us is when you look us in the eye. So they turned down the opportunity of material improvements in their well-being because they were not, because they were untouchables, they were Dalit caste, and they were not being treated with dignity. And I think that fundamental concept is going to pervade our work over the next decades, and it should have been doing so for a long time.
Rita. Sorry, muted myself. Rita, I wondered if you had something to say about what Jonathan was talking about at the beginning there about the South and the North.
Well, not really, but what I want to say is that at the African Union, our heads of states and governments are very much aware of how much we, especially at the Commission, of how much our countries and even the Commission, on how much we are dependent on development aid or foreign aid. And this is why there has been a decision from our heads of states and governments to now have to try to decrease this aid that we have. And our countries are very, I mean, Africa is a very rich continent. Africa is a continent with a lot of resources. And this is why there has been a decision now that we would like now to ask each of the countries to set aside about 2% of the taxes to go to the development of the continent. And this is a decision which has been put forward, and we are hoping that this decision will be implemented, and so that the continent can use its own resources, that the continent can be self-sufficient, that the continent can develop itself without having to depend so much on foreign aid, on development aid.
Great, thanks very much. Can we just, while we've got you, Rita, a follow-on for that. Henrika has asked here, to what extent have radio programs and other information been provided in the local language? You talked about radio programs.
Yes, I did. Now, as we know, each of our African countries does not have one local language. Each of our countries has so many local languages. Now, what has happened is that the messages on the health concerns on the COVID-19 has been done in many local languages in many of our countries. But now concerning the educational processes, that is the education, teaching and learning process, has not been done in local languages in many of our countries. As I said, there are too many. It has mostly been done in the official languages of the countries, that is English, French, Arabic, Portuguese, for Portuguese-speaking countries. It is not easy. As I said earlier, we know that many of our ministries of education, the teachers have had to, at the last minute, just to compile their notes and, you know, to put it online or to put it as a program, as a TV program or on the radio. So you can imagine having to do this in the different local languages of the country is not an easy issue. I have talked to some teachers. They have been facing very difficult times during this COVID. They feel stressed. So, I mean, the idea is good to reach the maximum number of learners, but feasibility is the issue. Thank you.
Okay, thank you. There's another one for you, Jonathan, here. Did you see that one? Examples of doing it differently? No, not that one, sorry. Whoops, where is it? Here we go, from Sally Brooks. Jonathan, how can we make the shift from dominant beyond aid and private finance? Can you see that one? To international public finance, especially in the light of Henrika's question above, which was about to what extent will it impact on remittances?
Yeah, so I wrote a book a few years back called The Trouble with Aid, Why Less Can Be More for Africa. Building on, I didn't know about that 2% idea, Rita, that's amazing. And, you know, African countries have been pushing to try and emerge from aid dependency. And at that time it was, and it's still really important. And at that time it was really important to send a message to the aid community that there are so many important things beyond aid. But the danger is that what's happening now is that that's being used as an excuse to reduce the North's responsibilities to actually continue to finance with cash redistribution and also sustainable development. And so what was required now is a re-emphasis on the importance of public money generally, and then especially and including in the international sphere. So we've had 30 or 40 years in which we've been told public is kind of bureaucratic and unhelpful and corrupt. Private money is the way forward. In the 2015 Addis conference before the SDGs, the big message was there's not enough international public money to do this. We need to call on the trillions of private money. Now, 5 years on from that, that has been pretty much a failure, which could have been predicted. I mean, it was a kind of a desperate attempt to kind of bring in private money when private money runs by its own rules, quite obviously. Public money is very, very different. So the twin response needs to be building up public resources at the national level, of course, and that means increasing taxation and spending it better. And it's incredibly hard to do. And again, there's been this kind of idea that should happen. You know, that will take decades to happen. So to contribute to that as well, we need to continue, yes, to build in the regional level, exactly as the African Union appears to be doing, already has done to some extent, but appears to be increasing significantly. Here in Latin America, it's not happening to any serious degree, and that's a massive problem. In Europe, it has happened amazingly well, with billions of dollars being transferred from rich to poor and to support you know, sustainable transport across Europe and all that kind of stuff. So that needs to happen, but also we need to double down and probably double in size the amount of money that is transferred from north to south, not in old-fashioned aid, because that leads to aid dependency, but in new ways so that it supports global objectives. How can that be done? Well, the Global Fund is getting there, but more funds like that. I was speaking to the NORAD top team the other day. They send aid, quotes, to 20 countries. Now, what if instead of Norway sending aid to 20 countries, they formed an investment union whereby all of those 21 countries put in money to support each other in responding to common themes? A totally different way of doing things. All of them sat around the table to decide how to spend that money. A totally different way of doing things. And that's the kind of thing that's happening around the world. In Latin America, you have kind of, you know, groups of countries doing that. You have more like triangular cooperation is growing. So this is happening. It's just not reflected. And we maintain the aid paradigm, which I think to some extent is holding us back.
Okay, thanks, Jonathan. Rita, did you see the question on admittances? Remittances, sorry, admittances.
Yes, I did. Okay, so what I want to say about remittances is that, of course, in most of our countries, the remittance flow is going to drop. And according to the World Bank report, they say by 23%. we know that in Nigeria having the biggest diaspora in the world, so of course the remittances are really, I mean, the Nigerians in their country are really going to feel this, especially because, I mean, the top 3 countries receiving remittances in our continent are Nigeria, Ghana, and Kenya. So if you imagine, this is about a quarter, 25% is going to be reduced, and this is going to have an impact on their families and their communities. Because in the African continent, I mean, you do not feed, I mean, when you send money, it is for the enlarged family. It is just not for maybe your father or your mother. It's for your uncles, your aunts, your cousins, etc. And as we know, many of our African brothers and sisters are losing their jobs or have had pay cuts due to the COVID-19 and have not been able to go to work because of those lockdowns. So of course, the remittance, the funds being sent home, of course, going to decrease. But let us hope that by next year, this is going to come back in the next coming year or the next 2 years, so that the remittances can come back to what it was. But of course, there is going to be a big decrease, as I said, by about 23%. Thank you.
Okay, thanks very much, Rita. Okay, we haven't got very much time left, so let's take the how may the merger of FCO and DFID limit or help the development sector with COVID-19? I'm going to jump on you, Joe, first. Being an ex-DFID person, I wondered if you have any ideas or any feelings or thoughts about that.
I'm afraid not. As a UN official, I have no reactions to that at all.
Okay. Anyone else on the panel? Yes, John.
Can I just tell a story? I was in Australia just when AusAid was merged into DFAT, and lots of stories going on about AusAid was now WasAid and everything. And I was actually working on how AusAid was using research to inform its policies and programming, and they had been massively increasing that over the previous 5 or 6 years. And we had just come to the point where we said, well, if you really want to use your research more effectively, you need to coordinate it better, because it was all being spent through different programs all over the place. And we said, what you really need to do is actually to increase the size of your central research department. And at that time, they had about 4 people in their central research department, compared to DFID at that time, they had about 20 or 25. And literally, the next day, they closed it down. Research was not seen as a major investment for them at that time, and they, well, you all know the story. They reduced their aid budget by about 50% overall. They refused to allow junior Australian staff to report into senior national staff. They lost a very large number of their national staff, completely undermined the organisation's ability to actually work in a way which really understood the context they were working in. So, I mean, I think there are lots of stories around which I very much hope DFID will learn from as they go through this process.
I don't know if anyone else has any strong feelings about this one. I'm going to throw in my tuppennyworth as well as an ex-DFID person. I think in terms of merging with FCO, I think the one issue around dealing with COVID, I worry will be the fact that to merge with FCO will mean that the 0.7% is not ring-fenced for poverty alleviation anymore. And I think the FCO, I think there will be ways found to get around that, and therefore there will be less capability in the future. That would be my biggest worry about it. I don't know if anyone else has any other views quickly. Yeah, Jonathan.
Well, I mean, I think there was possibly a strategic error by many of us in the development sector for not encouraging more relationship between the aid budget and other ministries. So in a lot of countries, including in Latin America, you know, the aid budget is kind of other ministries' budget, and the aid organization is kind of a small coordinating organization. So the health ministry spends money, the agriculture ministry spends money. Actually, it's quite a good way, I think, to link in other sectors to what is otherwise seen as a DFID stronghold. And I think that's somehow what it was seen. So I think in hindsight, we could have played it a little bit better. I agree with you, what you just said, and what John just said, and I think there will be quite serious damage. It was described by an old colleague of mine as kind of deliberate violence, or just kind of, it is deliberate violence. And I think that's the point. I mean, I think you can make it work. I mean, a lot of countries do make it work. You have a DFID and a Foreign Office that is together. The question really is, that's the technical question. The really question is the politics. They don't want it to work. They don't want it to work like DFID. And, you know, a kind of a progressive internationalist government could make this, could make an FCDO work perfectly well. Yeah, but they're not going to use it like that. We all know that. So we have to wait another 4 years. I mean, this is politics, and we have kind of our aid discussions as if politics doesn't exist. And a lot of people on the panel obviously aren't allowed to talk about politics. I am. It's a disaster. It's going totally the wrong way. And we just need to vote in a different government.
Okay, right. Okay then, let's have, thinking of the time, I'd like to ask all of our panelists just to give us a really brief, like 1 minute, 2 minute, just final thoughts. And I'm going to go from the middle outwards here. I've got Rita. Can I ask you first to just give us your final thoughts? So, you know, are you positive? Do you think that given all the challenges we've all put forward and those wonderful opportunities, are you positive that they're going to be realized? And do you think we can move to a better development world in the future? You're muted, Rita. Sorry.
Sorry about this. Yes, absolutely. I think that most of us are very much aware of what has happened and what has been the challenges in this unprecedented COVID-19. But I think that what really comes up is that everybody is ready to work towards ensuring that education is made accessible for all our learners, and especially girls and women. And something that I would like to add is that I know that many countries right now are working towards disaggregated data when schools are going to reopen, to ensure that we are able to count, we are able to monitor the number of girls who will go back to school. And I think this is something which is very positive, and which we are working alongside with the different ministries of education to ensure that the girls do go back to school after schools open.
Great, thanks very much. Jo, what are your final thoughts?
Yeah, I mean, I'm quite optimistic. It's obviously very difficult to predict anything given all the uncertainty, but I am actually quite optimistic that certainly in some countries, and we are seeing this already in some countries, that this does present an opportunity for governments and societies to look at things a bit differently, and to start you know, putting money where it will do more good for kids. So I am quite optimistic, you know, in some countries. I think where I do see a lot of the obstacles is really in these these big global discussions around global financing. And there, I think, yeah, we really just starting to kind of move beyond the initial thinking about how do we get an initial response, which, you know, we saw was a bit slow, but started to get there, but to really start to think about what does this actually mean in terms of transforming systems over the medium and longer term. And we really need to do a lot more on that. So, but I mean, I think there are some mechanisms. So let's try and be optimistic and see what a difference we can make.
Always good to be optimistic. Nick, can I move to you?
Yes, thanks. Well, I think that, I mean, let me just focus on one small area, because I'm very optimistic about that. I think basically we now see the potential, also the problems, of course, but we see the potential of remote learning. And I'm very optimistic that this can be, I mean, Jonathan mentioned his children, that was pretty interesting, but more broadly, I mean, I think we can see that this can be that remote learning can be used not only, you know, when children are not in school, but also when they are in school. In resource-poor environments, you can actually learn all sorts of things. If you don't have a science lab, you can still learn chemistry by doing it online, as it were. And I think that there is really a huge potential here. I'm talking at school level, of course, even more at the tertiary education level, which we haven't talked much about. But I think this is going to be one very, very positive thing that's coming out of this. People are now beginning to learn how to teach remotely. People are beginning to learn how to learn remotely. But still, we have to, you know, consolidate and systematize all that knowledge and make it available to everyone, because there's no way of pretending that this has worked particularly well in richer countries compared to poorer ones. It doesn't work very well in many countries. So I think that's, for me, the most positive thing that will come from this.
Great, thank you. John, can I move to you?
Yes, and I wish I had time to tell more stories about what happened around the merger of AusAid into DFAT, because that tends to dull my my normal enthusiasm. I mean, I would say I'm cautiously optimistic about this, but I think it will take a huge amount of work and a long time to change the prevailing attitudes and machinery in DFID or FCDO, UKRI, talking specifically about research in UKRI and the research councils. But I have to remain optimistic, because this is what we do as an organisation, and this is the key focus of our new strategy, which is called Unleash the Talent, Building Equitable Knowledge Ecosystems, because unless there are equitable knowledge ecosystems in developing countries, I think the kinds of disasters we see all around the place when the wrong people are making the wrong decisions that affect other people will continue. And so our vision is research and knowledge at the heart of development. Our work is about building the capacity of Southern researchers and policymakers to produce and use research more effectively. We've always done lots of stuff online. We're going to do more online. We shouldn't be traveling so much. We've always had a very empowering and equitable approach to capacity development. And I liked what I think Nick was saying about coaching rather than providing technical advice. And we've recently started introducing critical thinking approaches into tertiary education in Africa, which is generating huge excitement in the universities we're working with. And the other thing we're going to be working with is UK researchers trying to do what we can, and Northern Research Funders trying to do what we can to change the politics in a tiny bit of the development industry and the development research bit of the development industry, so that we get more equitable relationships between North and South, recognition of the importance of long-term sustainable funding for capacity development, and also that we should have more useful research being done more usefully. And I think some of the initiatives in the UK academia, like the REF, focus on assessing the impact and use of research, as well as its sort of academic, a number of academic publications. I think the Global Challenges Research Fund is starting to emphasize things about partnership building, capacity building and local impact. And there are changes starting to happen in UKRI, which are all pushing in the right direction. So yes, I remain cautiously optimistic.
Wonderful. Okay, Jonathan, we'll give you the last word. Hopefully you can find an optimistic word or two as well.
So I think, well, what John was saying actually is one of the most optimistic areas. I think what he said when he said, I have to be optimistic, is kind of sums up what most people working in this industry are. It's just our psyche to be optimistic. Sometimes clouds our judgment a little bit, and I think we have to be quite realistic as well about what's about to hit. But just before I get there, I think what John said about the research angle, I think we have, and it's tragic that it always takes a tragedy, which is what happened in the US, but I think this Black Lives Matter moment is going to be transformative. Just for one example, there's been some years working on the idea of WANLs and the idea that you can't have all men panels. Yeah, and now, but it's been quite hard to push the idea that you can't have white-only panels. By the way, this panel's okay. I'm on a panel tomorrow with the OECD where it was all white, right? It was about the future of aid or development post-COVID, about 4 or 5 people. It was all white people. And I just said, look, I can't do that. And now they've got a couple of people from the rest of the world, which is you know, progress. And I think that's increasingly going to happen. That's just one example. In the research world, you know, it's hard. There's so many papers written about the rest of the world, but which don't cite research from the rest of the world. It still happens. And I think that's changing, partly because of the great work of people like John. So that kind of thing, that arc of history cannot be set back now. Yeah, that's massively hopeful. And, you know, the voices you hear totally influence the way that you think and the politics that you eventually kind of decide on. So that's massively positive. The negative part is that I can't think of any example in history, and some people are going to be better historians than me, where out of a recession, either international or national, you get progressive policies. And we're about to hit, and it hasn't hit yet, a mega recession in the West and in many countries all over the world. And I don't feel particularly optimistic about it. I mean, you know, as a campaigner, and all of us are somewhat campaigners, whatever sector we work in, you know, you just have to hope and campaign really, really hard, because what history implies is that in the times of recession, we're going to be facing a massive backlash against internationalism and against the kind of progressive thinking that currently is dominating our media, the Black Lives Matter stuff. You know, give it 6 months, give it the recession to hit, and that's going to be pretty hard to maintain actual economic policies to back up, you know, the positive vibes that kind of are alive in our movement at the moment. So I think we have to be quite realistic about the context we're about to face. And again, I haven't even mentioned climate change, but that all the more reason to be wildly optimistic and to campaign even harder.
Good. Okay. I don't know about, on my timetable thing, I have here a few minutes to wrap up, a quick summary. I mean, it was never going to be easy to cover the development industry in the short time that we have, but we've worked right the way from, you know, changes in the sort of post-colonial attitudes, changing in research, right through to changing the international aid architecture. I think we could say that we're all fairly positive. We're all very, very aware that politics will, as always, get in the way. But it's absolutely heartening to find that there are so many people working with such positive energy and such positive ideas coming out. So I'd just like to say thank you to all of you for being part of the panel. And it's great to see you all again. It's lovely having worked with you, most of you, and not seen you for quite some time. So that's nice. And I'm going to hand over now to Piran, who's going to tell us about the next webinar that we have. Normally I would say everyone to give you a clap, but I don't know how you do that on Zoom. So thank you very much to all of you. Piran.
Thank you very much, Chris, for your chairing, and also thank you from the IGDC to all our panelists, John, Joanne, Rita, Nick and Jonathan. Thank you very much. Thank you also to our audience for listening and for all your questions. I think you'll agree that we've had a fascinating webinar in a highly topical area, and it's been a very interesting couple of hours. So the only thing that remains for me is to remind you about our next webinar in the series. So this will be on the 7th of July, and we will start to bring climate change into the debates, and it will focus on climate justice movements in the global south. And it will be chaired by one of our IGDC researchers, Dr. Jessica Omukuti. So please look at our website to find out more about this and the other events in our series and book your places. So thank you very much again for attending today. We look forward to seeing you next time. Thanks very much. Bye.